And I'm joined now by Canada's Auditor General, Karen Hogan. Thanks for joining me to discuss your reports. Let's begin with your findings on the border control measures during the pandemic. And of course, we still have some of them in place. They're designed to protect Canadians from the spread of the virus. Can you say, based on your audits, whether those border measures have put Canadians at risk?
So it's nice to be here. Thank you. So this was a second audit that we did on border measures. We followed up from an audit in March, and we wanted to see whether or not the Public Health Agency had improved on its ability to track and monitor incoming travelers to ensure that they were properly quarantining. And then we also looked at COVID-19 testing and mandatory hotel stays. And really, in many instances, we found that the department was unable to tell you or I whether or not the measures put in place were effective. And this was mostly because they had problems tracking and monitoring and following up.
All right. I mean, so if you put sort of two and two together here, if they aren't able to say whether they were effective, one might assume that there is some risk involved then to Canadians because they can't tell us whether the measures worked.
Well, I know that as a rule, I think Canadians are really good rule followers, and I trust and expect that everyone will continue to do right. But what we were looking at was not whether or not Canadians were following health guidance and the rules at the border, but whether or not the department was able to demonstrate that the orders that they had put in place were effective at helping to stop spreading the virus. Yeah. And they were really unable to tell us that.
I think that's the key, isn't it? I mean, Canadians may be rule followers, but there's no way of telling whether they followed the rules in all cases. I mean, that's what your findings suggest, correct?
That is it.
Okay. The Public Health Agency, let's drill down a little bit. The Public Health Agency had records to verify hotel stays for only 25% of travelers arriving in Canada. It referred those travelers to law enforcement for follow-up, but didn't know the outcome of 60% of those referrals. How come?
I think this is just part of, many of the findings that we saw in the border measures is that the agency hadn't really thought through how to monitor and enforce all of the requirements. And so we had the same findings back in March, that individuals that they thought were at high risk of not complying were referred to law enforcement. However, they didn't follow up. And so, at times law enforcement would come back to the agency, but the agency really is just unaware of whether or not people quarantined as they did, whether they stayed at the hotels as they were supposed to. And then obviously it leads you to the conclusion of whether or not the measures were actually effective.
Right. Testing at the airports, more than 80,000 on-arrival test results and 57,000 post-arrival test results could not be matched to the people tested. What happened?
Well, what we found here is that the department was unable to match or had missing test results in 30% of the travelers. And these are the tests, when you arrive on air and you have to do an upon arrival test, when they get the results back from the lab, they couldn't match them to a traveler and hence couldn't either inform them or confirm that all was good. Really, it fundamentally comes down to managing information and having the data that you need. And we saw an improvement in being able to contact travelers, but then I was disappointed that they didn't apply those lessons learned from the first audit in March to the new border measures here.
Right.
So it was concerning that over 1,000 travelers who tested positive were unable to be reached by the agency because they couldn't contact.
Do you consider these findings on your part? Do you consider these measures at the border to have been a failure?
So it really isn't up to me to comment on the policy decisions about what measures should be in place at the border and when they should be added or removed. It's my responsibility to look at whether or not the government has set clear expectations, that the requirements are communicated and well understood, and then that they have processes in place to monitor and then to report on the effectiveness of the measures that they've put into place. And our findings are such that they need to do a better job at that tail end of that.
All right. Let's talk about the inspections that were supposed to protect temporary foreign workers in the agriculture sector in particular and prevent the spread of COVID. 95% of the inspections, as I understand it, are done virtually. why were those inspections a failure? And let me just jump ahead if I can. You actually pointed out the shortcomings to the government and extended your audit period to see if the inspection process would improve after you pointed it out to them. But it got worse. You waited until now, though, to say so. And I guess I'm wondering whether you think you should have reported the worsening situation sooner.
So in this audit here, we looked at the temporary foreign worker program, and I think it's important to understand the role that it plays. The temporary foreign workers fill a labor shortage in our agricultural sector, and they're a key element to Canada's food supply system. We looked at the inspections that looked at COVID measures, and as you pointed out, I spoke to the department back in December and sent them a letter, and I have to admit that I'm deeply disappointed that things worsened. But what I asked them to do back in December was to prioritize the health and safety of the temporary foreign workers instead of responding to audit recommendations and coming up with a detailed plan. I expected that they were going to take concrete action to improve the living conditions of temporary foreign workers and also to improve the quality, rigor, and timeliness of their inspections.
But that didn't happen.
Did not. No.
All right.
No, it did not.
No. You also found that pandemic programs to support the food supply did help, but what's still missing to protect the food system is a national plan for national crises such as the pandemic. What response did you get to that finding? And is the government, I mean, they promised a plan, I think it was 2009, we're still waiting.
So during our audit on protecting Canada's food system, we actually looked at 5 initiatives that were delivered by 3 different departments. And we found that they quickly provided pandemic support by leveraging existing programs and existing mechanisms. But concerning was that there was no nationwide emergency preparedness plan that covered the whole food system. So the plan that existed actually looked at the front end, which was production and processing, and really didn't consider all elements of Canada's food supply. So distribution, consumption, and what to do with excess food. And I think we're seeing all too well the importance of how the whole supply chain needs to be thought through in the time of a crisis. We're seeing it out in BC. We're seeing it in Nunavut. And really they have to sit back and think of a plan that considers, from farm all the way to fork. Right. And they acknowledge that they need to do that, and they will work on it.
All right. Canada's Auditor General Karen Hogan. Lots more about the reports today on our website at cpac.ca. Madam Auditor, thanks so much for your time today. Great to talk to you.
Thank you.